This is the kit that we're going to be using today. We've got a carbon dioxide laser here. This is the handpiece from which the laser beam will come. We use it in conjunction with a medical smoke extractor. So that's this piece of kit here. So this removes all of the noxious gases that are produced when we're burning through tissue. So none of that will fill up into theatre. And then the final piece of kit that we've got on the trolley here is an electrocautery unit. So if we get any bleeding, we can cauterize that with this unit. The laser itself is very good at cauterizing smaller blood vessels, but anything over about 1 millimeter in diameter, we would need the assistance of this. So this is our patient for today. This is Aoife. He's going to undergo laser surgery for sarcoids. Aoife's already had a pre-med about an hour ago, the drug ACP, and it's just the first of its induction agents, xylazine. We'll just leave it for another 5 minutes and then we'll actually induce it into anaesthesia.
This is an endotracheal tube which, when we place in the trachea of the airway, enables the horse to breathe the anaesthetic gases which will keep it asleep during the course of the surgery. Someone just press on the chest for me. Okay, so there we are, the tube's in, just checking that it's in the trachea, which it is.
So the first thing we're going to do is we're going to have a look over our patient and identify where the sarcoids are. So the first one that we've got is just here on the chest. We always have a good feel in the armpits, in the axilla region, because this is a site where they very commonly have sarcoids, and it's very common when the horse is under general anaesthesia for us to find additional lesions other than those which have already been noted, because obviously we've got the luxury of having the horse upside down. Sarcoids are a form of skin cancer in the horse. So here's a very typical sarcoid on the chest of Aoife, our patient today, but you'll see that further back she's got a number of other lesions as well. And the average for animals which present with sarcoids are around 7 or 8 lesions on one animal. So the plan for these will be to remove them with the carbon dioxide laser. So the technique is relatively straightforward. What we do is we mark out our margin and literally just sketch that on with the laser like so. And as you can see, we're taking about 1 centimetre in terms of margin around this lesion. These are malignant skin tumours in the horse, so we always need to take a margin around them to make sure that we've not only got the tissue that you can see is already a tumour, but we make sure that we've also got any tissue that's surrounding the tumour which is going to develop into more tumour. And once we've sketched out the margin that we're going to take, we then just cut down onto an edge using the laser and just cut a little bit deeper. And once we've created a slightly deeper incision, we can then just pick that up and create a little flap. And then we can just use that flap to then undermine the tumour and excise it, as you can see. So you'll see that one of the advantages of using the laser is that we get very good control of bleeding. If we'd taken a scalpel to this site, it would already be a sea of blood and we'd be having to staunch the flow of blood and clip off vessels and so on and so forth. Whereas with the laser, as you can see, so far we haven't got any bleeding. The laser is very good at sealing smaller blood vessels up to about 1 millimeter in diameter. Because of the heat that it's generating, the laser is cutting at about 100 degrees Celsius. Because we've got all that heat being produced, we are reducing the risk of spreading any tumour cells into the surgical bed, because the only thing that's doing cutting at this site is a beam of very hot light. So we've got a beam of light, as I say, that's nearly 100 degrees Celsius, which is just vaporising everything it's coming into contact with. Whereas if we try to remove this with a scalpel, there'd be the risk that as we move the scalpel through the surgical bed, potentially we can pick up tumour cells and we can end up what's known as seeding them throughout the surgical field, which just means that the tumour is then much more likely to come back again. We get very high success rates using the laser, well over 90%, around 92-93% in the most recent studies that we've done looking at our caseload. So this vessel here, we're just going to cauterize that because it is a little bit too large for the laser to have sealed. So we're just going to use an electrical cautery device, which is just effectively a heated wire, which just seals the vessel like so. And then we can continue to cut on. The laser won't cut through fluid, so if we have got some bleeding that the laser doesn't control, then we've just got to use something like that cautery device just to stop the bleeding. But as you can see, it's a very quick way of removing a tumour, and that's important because certainly in this case we've got a horse under general anaesthesia, so we don't want to have the horse anaesthetised for any longer than we have to. And also, of course, the more time the procedure takes, the more expensive it's going to be. So again, the faster we can be, it's much better both for the patient and for the client. Nearly finished with this now. A little bit of bleeding, which we'll just cauterize. The laser beam itself is just a fraction of a millimetre across, so it's an extremely accurate instrument to use. So we can get very precise surgery, and a lot of the surgery that we do is around, for instance, the eye with the laser, and for a lot of those cases actually we can do those with the horse standing without using general anaesthesia because of the accuracy of the laser. generally the reasons we would want to have the horse in general anaesthesia will be to allow us access to particular sites, anatomical sites, in particular usually around the medial thigh area or the genitals, which we can't access adequately, and we can't get good visualization unless this patient's in a recumbent position under general anesthesia. Okay, and that's the excision done. And then what we're going to do is we're going to go over the surgical bed with the laser in a technique which is called ablation, or rather more colloquially painting the bed. And you'll see that that helps the tissue to contract slightly, and it also just seals the surface so that we're left with a drier surface rather than an open oozing surface, which just helps with the healing process. And it also means that had we contaminated the surgical site with any tumour cells, which as we were saying before hopefully is very unlikely because we're using a laser rather than a scalpel, but had we had any contamination there with tumour cells or alternatively bacterial cells or whatever, by going over the surface with the laser, which as we say is producing nearly 100 degrees of heat, it just cauterizes that site. You can see how the tissue is both drying and also contracting slightly as we run over the surface with the laser in this painting the bed or ablation process. So we just go over the entire surface, moving in a cross-hatch way, just to seal the entire site. I'm particularly interested as well in the surgical site edges. And that's our excision complete. Ta-da!